Well, today we're in Manhattan with a beautiful view of the Empire State Building, and I am with Dr. Goldstein. Welcome to the show. How are you?
Thank you so much. It's so good to be here.
I'm very excited. We're here at Esse Care. Tell us about this practice.
Absolutely. So, Esse, the word, one of the definitions I found when I was starting the company a few years ago was the joining of two opposing principles. And for me, I'm a minimally invasive gynecologic surgeon, so I do a lot of complex pelvic cases like endometriosis and fibroids and hysterectomies. But I always found that there was something lacking with surgical care in that, a lot of surgeons perform really amazing surgery, and then after that, it's like the relationship is done and the patient's, sort of left on their own. And so what I wanted to do was really bridge together all of the important pieces for the patient so they don't have to go searching for all of it afterwards. So bringing on board nutrition and wellness and hormone care and all of the other aspects that they really need in gynecologic surgery world. And
So it's more about reproductive surgery, but also the wellness component.
Yeah,
you
absolutely.
blend all that together for them.
Yes, yeah.
I think that's fabulous. What is that, that whole person approach for you?
So I was an endometriosis patient myself for many years. I had many surgeries and a long journey with infertility. And, when I was younger and when I was going through all of it, I was sort of always searching for things like I would go to acupuncture, and I went to osteopathic medical school. So I was sort of raised up with whole body wellness, and the body is an integrated unit, and you can't just fix one small thing. You have to think about the body as a system. And I think it's really true for conditions like endometriosis that, we treat one thing, but there's still so much interplay with what happens afterwards, And so I really like to collaborate with all different providers like pelvic floor and acupuncture and a really awesome nutritionist and primary care internists, and bring teams together so that the patient really achieves their best state afterwards, and they feel really good, but they also know what am I going to do in the future, and how am I going to tackle all of this afterwards. I found that when I was a patient, I was always searching for things. So, okay, who's the best acupuncturist, and who should I go see for this, and what nutritionist knows the best thing about this today, and it's a lot on the patient. It's so much research you have to do on your own. And a lot of my patients come to me after so many years of infertility or endometriosis, and they could have a medical degree by the amount of research they've done by that point. And, the goal is always to make it easier, right? And make it a more seamless process, make pre-op, post-op, even if they're not surgical, make it a sort of hand catered and curated experience that's nice for them and complete.
Why is it that the symptoms mimic other things? Because a lot of times people are misdiagnosed when they actually have endometriosis.
Mm-hmm. Yeah, great question. Endometriosis can occur all over the abdomen and even up into the thoracic cavity, even into the lungs. And there's a lot of interplay even with nerves that run through the pelvis where symptoms can become systemic. And there is a lot of interplay with chronic pain that has even neurologic symptoms down the road. And so endometriosis often, by nature, it's a disease that is not a disease of the uterus. It's a disease where tissue that is similar to uterine tissue is growing outside of the uterus. And so
I did not know that.
Yeah, and so they're not, they look identical in the microscope. So
Okay.
They look like endometrial glands or stroma that line the endometrial cavity and are shed every month with a period. However, they're not from there necessarily, and they are growing in ectopic places all over the abdomen. And so often endo can grow on the bowel or grow right next to the bowel, the intestines. It can grow on the appendix, on the bladder. And then wherever it's growing near, the patients can have symptoms of those things. So a lot of endo patients are told, oh, you have interstitial cystitis or something wrong with the bladder, or they have frequent urination and pain, and then they think it's a bladder issue and they see a urologist. Or they're having bowel issues for years, they see a gastroenterologist. They have 3 colonoscopies, all of them are normal. And it's super frustrating. And then all of the imaging they try to get, imaging for endometriosis, it can show stage 3, 4 disease, but it does not pick up stage 1 and 2 disease very much.
Okay.
And so it's very frustrating for patients because oftentimes even when we're going into surgery, we have no proof that there's endo when we're going in for surgery.
Oh my goodness.
It's all based on their symptoms,
Okay.
on their story, on everything that's bothering them. And that, I like to tell patients, is like a map. It's like a constellation map of what's happening in their pelvis. And every single one of those symptoms, they have leg pain down one side, they have painful intercourse, they have, bowel symptoms since they were 15 years old. And, those things are all really like a map of what's happening in the pelvis. And so the best predictor of endo is really their story,
Okay.
not any imaging.
And you're a good listener. And so by the time somebody comes to you, you said sometimes they might have been dealing with this for about a decade.
Yes.
And then they finally find you. And then you're able to talk to them and understand what's happening.
Yeah. So one of the things when I first started my practice was I always have like a teapot and cups of tea that are very nice. And I sit with patients for an hour on their new patient visit.
My goodness.
And there's often tissues like these. And it's a story, and I know that it's been a long time for them to get to that point. Some of them fly in from across the world and across the country. And, it's a very long road to get to that point where they're listened to, they're cared about, and everyone in the office and in our company, I want them to have that same listening skills and embody that same approach because they've been through enough hurdles. They don't need to be proving anything when they walk in the doors.
Do you find that your patients, once you share with them your own personal story, realize that you can almost empathize with them, right? Like you've walked the walk, you talk the talk, but you've actually been in their shoes.
Yeah.
How did you find help? Was there someone that, like a mentor or somebody along the way that said, I think this is it? And then you decided to have your practice go into that?
Yeah, I did. I had a mentor, my very first endo surgery that helped me. And, he helped me with my first endo surgery. And then I ended up training under, a brilliant mentor at Lenox Hill for years. And so I had a lot of help and was I matched at Lenox Hill. I ended up training at Lenox Hill and I really wanted to go to Baylor and Texas where my family was. And I ended up matching at Lenox Hill, and it was probably serendipitous that, I ended up matching there and training extensively in endometriosis and then had it and then had the surgeries and the infertility. And I had a lot of help with my infertility doctors along the way. And I have 2 little miracles, but it was a long road. But yeah, I think all of that, it was sort of meant to be, I guess, that I dealt with those things so that I can provide that for the patients, that they know that it's not, that I do get it, and not every physician has to get it or go through all these things. But, I think it allows them to be comfortable right away that I'm not going to sort of dismiss them and not understand what it's like to deal with those things,
Well, we just got to visit with Dr. Goldstein, and now we're here with Dr. Rosen, Dr. Lee Rosen. How are you?
Hi, I'm great, thank you. How are you?
Good. I got to learn a little bit about you, and one interesting fact is Mount Sinai plays very prominently in your life. Tell us about that journey.
This is true.
Okay.
Yes, so I went to medical school at Mount Sinai. I then did residency at Mount Sinai. I stayed on for fellowship at Mount Sinai. I worked at Mount Sinai. And I was born at Mount Sinai as well. My whole life.
It's your whole life.
Yes.
From cradle to all the way.
Correct.
It's so nice to be here. Esse has such a beautiful vibe here. Esse Care kind of embraces what it is, the feminine energy, right?
Yeah.
Tell us about, now that you've been with the practice, what your feelings are about Esse Care.
I mean, I've been here now, I guess, almost 4 months, and it's been incredible. Mainly because I feel that they are dedicated to figuring out how to enhance the patient experience and really individualize care and constantly make changes. If something isn't, optimal for a patient, we always, tweak it, and they're just really wonderful in that way.
Now, some of the things that you work on are unique, right? There's fibroids, but we were talking about the difference between I know the term hysterectomy.
Yes.
But now there's a
hysteroscopy. Yes.
Oscopy.
Yes.
Okay, which sounds almost like a colostomy, like all these,
Yes.
like all of those like words are all medical words, all
Yes.
come from different roots and things
Yes.
like that. But I was like, okay, so what's different now? What is
Yes. The difference
how can
between...
you do that, right? From a hysterectomy going to something that's maybe less invasive?
Yes.
Okay.
So hysterectomy is the term for removing the uterus. Hysteroscopy is really placing a camera to look inside the uterus.
Okay.
And then there are different types of procedures that can be done on the uterus by means of using a hysteroscopy.
Okay. So it's a scope, if
It's
you
a-
will,
yeah.
that can, like a little CNI camera.
Exactly. It's a small camera that goes really small, goes in the vagina, all the way into the cervix, into the uterus itself.
Okay. And so from there, you're able to see like, okay, maybe this needs to just be frozen cells as opposed to maybe surgically removed, or
Yeah,
is that what you
exactly.
help make your care path through that?
Well, it's a little bit. Sometimes it's that someone will find out that they have a growth in their uterus that's causing issues. So for
Okay.
example, a polyp, which is a growth in the uterus that can cause abnormal bleeding, fertility issues. Another type of growth that will be there could be a fibroid. And so sometimes a hysteroscopy is used to look inside, confirm that either a couple of these things are there, and then can also remove these things as well, depending upon the situation.
When you have a patient present to you in that way, do they sometimes have more than one thing going on at the same time?
Yeah, they can.
Okay.
They can. I mean, there's pretty good imaging now that's done before going into doing a procedure like this. So usually you know what what to expect when you're doing the hysteroscopy, but sometimes, yes, you can have multiple things going on. I work very closely with a lot of fertility practices in the New York City and Connecticut area, and so a lot of patients who are struggling to get pregnant, they'll go see their fertility doctor, and their fertility doctor will do a workup, and they'll determine that, oh, you have something that's structurally in the way that needs to be removed in order to help get pregnant. And so I see a lot of patients in that way. So the fertility doctor will contact me and say, Lee, I've got this situation, can you see this patient and help? And so that's a lot of what I do.
What is the reward for a physician, a surgeon like yourself, after the patient goes through something and then you're helping them with their wellness here at this practice? What is the give back to you? Have you seen like life be changed or?
Yeah, I mean it's the best part of it. I have to say, I think, well, from a fertility standpoint, being able to help people get pregnant and achieve those goals, I mean, it's really incredible. Every so often I'll get a patient of mine who will send me a message and with a picture of their baby, and it's unbelievable. But I also think, a lot of people I meet have had experiences in the past with their gynecologist where maybe the communication wasn't so great, or they didn't really feel heard or respected. I don't know, it seems to be something that I see a lot. And so being able to basically contrast that with a patient and make them even just a visit, and then they feel like, wow, like I actually know what my options are, I feel comfortable, and I want to take control of my life and my health in this way. So just basically being able to do that for someone is really rewarding.
What would you like a future patient to know? Like, what is one thing that you would want to convey to them to let them know that it's okay to seek that advice, or to go to the website to learn more, or
Right.
what if we were going to do our best job to like invite them in? What do you want them to know? What's a good first step?
Well, I think that I do meet a lot of patients who, at the end of our visit, they'll say, wow, like I can't believe that, you spend so much time talking to me and getting to know me and giving me my options and not judging me. And I'm like, that should be how it is. So please, if you're ever in a situation where you feel like you're not being listened to, you're not being given options, you gotta go somewhere else. Dr. Goldstein and I, one of the things we have in common is we don't have egos. We're very much like, this is about the patient, and this is always about the patient. And so that, I think, is so critical in terms of really giving good care.
Thank you so much. stay tuned for more. We have been living it up right here at Esse Care in Manhattan. They do have 3 locations. People travel to them, or they'll travel to those locations. But if this is the place that you feel you need to be, please reach out to them.